All right. Hi, everyone. Thank you all for joining us today for the kickoff call for the 2019 cohort of the Tribal Opioid Response Grant. If you haven't met me before, my name is Jeff Ladolter, and I'm the program manager for the TOR Technical Assistance Grant through the National American Indian and Alaska Native Addiction Technology Transfer Center, or ATTC. I'll be your point of contact for technical assistance questions that come up throughout your course of implementing the TOR grant, and my email is on the screen under Contact and Support. This meeting will be recorded. Participants will be muted for the duration of the meeting, but you can ask questions in the chat box and we will address them throughout the presentation. To kick this off, I want to start by introducing Dr. Alec Thundercloud of the Ho-Chunk Nation, who is the Director of the Office of Tribal Affairs and Policy. Dr. Thundercloud, are you there?
Yes, I'm here. Good morning and welcome everybody, and good afternoon to other folks who have joined the call. Thank you. Welcome to the Tribal Opioid Response Orientation Webinar for 2019. Congratulations, grantees. I want to thank our partner offices, the Center for Behavioral Health Statistics and Quality, and the Office of Financial Resources, and our AIA and ATTCs for participating in this call and assisting us with this. Before we begin, I just want to give you a little background. SAMHSA Support for Tribes is really to commit the support of the delivery of services and resources to maintain and improve the behavioral health of American Indians and Alaska Natives throughout the country. The Office of Tribal Affairs is a fairly new office, and it serves as the primary point of contact for our tribes, our tribal organizations, and urban Indian programs, as well as our other stakeholders on tribal behavioral health issues, including our Tribal Technical Advisory Committee, which is comprised of representatives from the 12 IHS areas, including 2 advocate members. Our office also leads and supports SAMHSA's work to improve behavioral health in tribal communities throughout the country, as well as substance use disorder issues throughout Indian country. Our office also leads tribal consultation in concert with our regional administrators and our regional directors, as well as outreach, education, engagement efforts, and again, being the primary source of our Tribal Technical Advisory Committee. Today's presentation overview will consist of a TOR program overview, the programmatic expectations, data collection and program evaluation overview. We'll have an overview of grants management and fiscal expectations, as well as an overview of Technology Transfer Center, TTC program overview. We'll end it with a Q&A. We do have, an hour and a half scheduled, so we'll move fairly quickly to leave enough time so that we can have some questions and answers for all of you at the end. I anticipate you'll have some. Thank you very much for joining the call. And now I'll introduce our OTAP GPO, Will Longetti.
Thank you, Dr. Thundercloud. So I am Will Longetti. I am one of the 2 project officers who have been assigned to the Tribal Opioid Response Grant Program. Today I'm going to talk to you about some of the key components of the funding opportunity announcement for the TOR grant. Here is the breakdown of the grant assignments for each project officer on the TOR team. So if you are a grantee based in any of the states in Health and Human Services Region 7, 8, 9, or 5, and it includes all of those states below, you'll be working with me as your project officer. If you are based in any of the states in HHS Regions 1, 2, 4, 10, or 6, you'll be working with Amy Romero, who will be talking with you shortly. We will also be bringing on a third project officer who will, once they're on board, they'll be working with TOR grantees in regions 5 and 6, which includes those states listed there. So today I'll be reviewing 3 components of the TOR grant program, including the purpose of the program, SAMHSA expectations for the program, and also the required activities under the grant program. As referenced, all the components we'll be discussing are outlined in the funding opportunity announcement for the grant. The purpose, as stated on page 5 of the funding opportunity announcement, is as follows. The TOR program aims to address the opioid crisis in tribal communities by increasing access to culturally appropriate and evidence-based treatment, including medication-assisted treatment using one of the 3 FDA-approved medications for the treatment of OUD. The intent of the TOR program is to reduce unmet treatment need and opioid overdose-related deaths through the provision of prevention, treatment, and/or recovery activities. The program supplements other current SAMHSA activities focused on reducing the impact of opioids and will contribute to a comprehensive response to the opioid epidemic. And here's a map we have put together showing you the location of all of the 164 funded TOR grantees. You can see the location of the 134 grants awarded in 2018 and the 30 new grants that we awarded in 2019, so pretty widely dispersed across the United States. On page 6 of your funding opportunity announcement, you will see a summary of SAMHSA's expectations for the TOR grant. Here are some of the highlights. SAMHSA expects that grantees will provide and develop opioid misuse prevention, treatment, and/or recovery support services for the purpose of addressing the opioid abuse and overdose crisis within tribes. SAMHSA intends that grantees begin the delivery of services as soon as possible after the award. At the latest, award recipients are expected to provide grant services to the population of focus by the 4th month after the grant has been awarded. Key personnel on the TOR grant is considered the project director. In this case, the project director must make a significant contribution to the execution of the TOR grant and will also serve as the main point of contact for SAMHSA. Note that this position requires prior approval by SAMHSA after review of credentials of the staff person and the job description. So if you plan to make any change to your project director, that is something that requires approval from SAMHSA in advance. SAMHSA also outlines the TOR grant's required activities starting on page 7 of the funding opportunity announcement and continuing on to page 8. You must use SAMHSA's TOR grant funds primarily to support evidence-based prevention, treatment, and/or recovery support services as described in this section of the FOA. All grantees are required to prioritize the delivery of medication-assisted treatment services. Grantees are expected to select activities from the list below on which your program will focus. Complete a comprehensive strategic plan based on the most current epidemiological data for the tribe to address the gaps in prevention, treatment, and recovery identified by the tribe. These plans must be completed within 60 days of award. Tribes may use existing plans if available. If the tribe does not have an existing plan, they may submit the tribal action plan. And here we have continuation of the required activities that grantees may choose from. Implement workforce development activities to ensure that individuals working in tribal communities are well-versed in strategies to prevent and treat opioid misuse. Develop effective prevention strategies, including strategies to purchase and disseminate naloxone and providing training on its use to first responders and other tribal members. Implementing service delivery models that enable the full spectrum of treatment and recovery support services that facilitate positive treatment outcomes and long-term recovery. Implementing community recovery support services such as peer supports, recovery coaches, and recovery housing. Providing assistance to patients with treatment costs and developing other strategies to eliminate or reduce treatment costs for under and uninsured patients. providing treatment transition and coverage for patients reentering communities from criminal justice settings or other rehabilitative settings, and working with tribal epidemiology centers to assess the impact of the grant. Please note that you don't have to perform all of these activities, but rather you will have to select from this list of required activities in your grant operations. I will now turn it over to Amy Romero, who's going to discuss with you allowable activities and other TOR grant expectations. Thank you.
Thank you, Will. I will be covering allowable activities, grant expectations, evidence-based practices, and funding limitations with TOR funding. We encourage you to incorporate culturally appropriate and traditional practices into your program design. We recommend to support and use telehealth strategies, especially in rural areas, to increase capacity and access to services, and to develop tobacco cessation programs. Other expectations. Coordinate activities with other funding sources to eliminate duplication of services. Utilize other sources of funding when possible. For example, purchase and refer care, health insurance, Medicaid, or Medicare. SAMHSA encourages TOR grantees to address the needs of veterans, service members, and their families. Adopt tobacco-free facilities and policies, except in regard to tribal traditions and practices. Help participants with health insurance applications. Collaborate with other systems to coordinate needed services for clients, for example, coordinating with the Veterans Health Administration or Senior Services. SAMHSA requires all grantees to utilize evidence-based practices. Patients diagnosed with an opioid use disorder should receive medication-assisted treatment. If you're not able to provide MAT at your program, you must refer to MAT services. For more information on evidence-based practices, please visit the National Institute on Drug Abuse website, listed on the slide. The last bullet includes a resource that provides guidance on how to adopt evidence-based practices to make them culturally relevant and appropriate. Funding limitations and restrictions. 25% of your grant award can be used for data collection, evaluation, or infrastructure development. Only FDA-approved medications can be purchased with this funding. There is new guidance that states TOR grantees should not use SAMHSA funding to provide treatment of SUDs and mental health disorders using marijuana. You have to submit an attestation letter agreeing to this new term via ERA comments. Program performance reports. The FOA states that grantees must submit a progress update at the midpoint of each grant year. That is due on May 31st. We often like to share best practices and success stories with our leadership and the Secretary's Tribal Advisory Committee on a quarterly basis. Your GPO will be asking you for quarterly updates via phone or email. An annual report is due at the end of each grant year, and that is listed on your Notice of Grant Award and is due on December 30th, 2020. Government Project Officers' responsibilities. The GPO is the main point of contact for program issues. Our role is to monitor progress and support your program to be successful, and to provide you with any information that you may need. Please review the following documents. The Funding Opportunity Announcement that includes all requirements and restrictions, that is the FOA. Your grant application includes population of focus, target numbers, identified contractors, and evidence-based practices that will be implemented. If there are any changes, please let your GPO know. And the Notice of Grant Award that includes special terms and conditions. Here is our contact information. Please contact us with any questions specific to your program. And right below our names are the states that we each manage. At this time, we can take questions on anything that we have presented so far. So we could unmute the lines and take questions.
I'm afraid we can't unmute the lines for participants, but people can add any questions that they want answered in the chat box, and we can address those now. So Elizabeth asks if there's a format for the strategic plans, and I think I might be able to address this. We actually have a template for you on our TOR resource page, which is on our website. I will link it below. It's not a required template, but it includes all the things that should be included in a strategic plan.
Any additional questions?
Oh, it looks like Jim asks, if the clinic does not have enough space for MAT for all the clients, do we refer to another doctor not in the IHS system?
Yes, it is allowable. We would like all clients to receive services, so those services are not available at the IHS in the IHS system, so it's okay to refer it out, but we want to make sure that they are able to access those services.
Okay, and is a doctor supervision required for MAT administration?
That's going to depend on the type of provider, the licensed provider, and the state board provider requirements. And it's also going to be dependent upon IHS's new policy on data waiver providers who can provide oversight to licensed independent providers from a remote site.
You can contact your designated GPO for more specific answers to that question.
Okay, will you put more detailed guidance about this?
Yeah, I think we recommend that you contact your project officer assigned to your grant, and they will give you more detailed guidance in response to that question.
Okay, Colby asks, the strategic plan is not mandatory, correct?
That's correct. The strategic plan is not mandatory, but it is on the list of activities you may choose from, but it is not mandatory for all grantees to complete.
And Patricia asks, what happens if we expect, say, 100 MAT clients to be served and we have turnover and it will become difficult to meet that number? What are the steps we can take?
You can discuss that with your GPO, and your GPO will work with you. We may have to do, in some cases, a change of scope, but we will make sure that we address that issue and that we address the barriers and are able to change the target number.
And the next question, whether you can use your tribal action plan in place of a strategic plan. Yes, you may use your tribal action plan in place of a strategic plan.
And Carlos asks, we have a strong prevention focus. Will we enter data into Sparse?
Hello, this is Darren Fulmore. I'll be speaking briefly on the system that supports program monitoring and performance management, and also known as SPARS. All grantees should report at the grantee level on whether or not there will be kit purchases and kit distribution. And they can, if they say no, obviously they won't move forward, but if they say yes, there's 3 questions there that talk about whether or not how many kits were distributed by the grantees. Naloxone kits.
Yeah, if you are only conducting prevention activities, you will likely not have to enter client-level data into SPARS. But we will provide more details on that later in this webinar, and also we'll have an entire webinar dedicated to that topic.
Do we have any additional questions at this time? Okay, so I think we can transition to our grants management presentation with Nicole Cleveland.
Yes. Hello, everyone. Just going to go over some basic topics for grants management, and just keep in mind I will send out some of this information, most of this information electronically to you, so don't feel like you're going to miss a lot of information, because with dates and everything, sometimes that can kind of get lost in the conversation. But the top topics that I want to go over today, are just very briefly, are notice of awards, just reiterate some things, the payment management systems, SAMHSA and recipient roles and responsibilities, post-award actions that require prior approval, reporting requirements, and ERA commons. Just keep in mind your notice of award is a legal document issued to the applicant and or organization. It contains legally binding terms and conditions, award expectations, reporting requirements, instructions on how funds may be requested. Some of this information was just reiterated to you earlier. The notice of award and its contents basically has basic information, your grant award number, your PD's name, for lack of a better term, that's your program director's name, your grantee and or business address, your award data, award calculations, payment information, terms and conditions, program income, special terms and conditions, and reporting requirements. Keep in mind, all of the information in your notice of award is important, but I want to reiterate to you the payment information, terms and conditions, and special terms and conditions, because a lot of this information has date information in which with suspense dates. Next slide. We're going to go over the Program Support Center Payment Management System. Payments, basically the recipient indicates acceptance of an award and its associated terms and conditions by drawing down the funds from the designated HHS payment management system. If there are questions before drawing down funds in regards to terms, conditions, special requirements, it's best to get those things ironed out before you draw down funds, because drawing down funds is accepting of all terms and conditions. The recipients must request funds from HHS's, PCS's payment management system. Recipients that are not in the restricted status may make electronic funds transfers, payment requests as often as needed, daily, weekly, monthly, and or etc. Drawn down funds must be expended within 3 days. The recipient roles and responsibilities. The authorized organization's representative, shown in ERA as the SO. This person is authorized to sign the grant application as the official representative of the applicant organization and to act on behalf of the applicant and assume the obligations imposed by the federal laws, regulations, requirements, and conditions that apply to grant applications or awards, including the fiduciary authority responsibility. The project director or the PD is the individual who provides daily oversight of the grant, including fiscal and personnel management, community relations, implementation, and evaluations. The business official is the official identified in the application as being the primary party responsible for overseeing the financial aspects of the grant, i.e. the authorized representative, official, accountant, bookkeeper. And for the authorized representative, business official, more often than not, we're looking for their signature or any changes for key personnel, any changes in regards to funding information. Post-award actions that require prior approval. Some post-award actions require explicit prior approval from the SAMHSA grant or the GMO, Grants Management Officer, in the form of a revised notice of award before being implemented. Those instances where approval is required are referred to grant post-award amendments. Failure to obtain prior approval when required may result in the disallowance of costs, termination of an award, or other enforcement actions. Common prior approval activities, significant rebudgeting of your award that's basically greater than 25% of your approval budget, change in key staff, project director, change in key staff with the percentage of level of effort. If you're going from 25%, less than 25% as the project director, change in the scope of work, what was discussed earlier, carryover funds, carryover unspent funds of over 25%, change in recipient organization, no cost extensions, purchase of equipment in excess of $5,000, transfers, and relinquishment. I know it's a lot of information, but again, I'm going to send this same information out to you all as well. Although not necessarily a post-award change, the following also requires prior approval. If your grant or your project is in a restricted status, advance and reimbursement payments, you are authorized to get prior approval. Prior approval comes in the form of contacting your grants management specialist, myself, as well as your project officer, your GPO, government project officer, I'm sorry. Prior approval for the key staff, I'm just going to go over this basically. The processing of a key and staff change or project director, you are supposed to submit a cover letter or narrative that explains the support that needs to be changed of the key personnel and or change of level of effort dedicated to the award. A curriculum vitae of that person, the position description, the HHS checklist, describing the duties and responsibilities that have changed, if any, and why. And the proposed PD's ERA Commons ID must be an accompany of this request. And also keep in mind that letterhead of the narrative or justification has to be signed by your authorized representative or business official, and that needs to be uploaded into ERA Commons. Processing of key staff change. Prior approval requests contain the following: change in the key personnel level of effort, changes to the key personnel in the level of effort requires the budget revision. If there's changes to the salary, drawdown funds in which that particular project director is receiving grant funds, that information needs to be revised in your 424, 424A as well. Prior approval for a significant rebudgeting, 25% or over. There's certain documents that you need to submit in regards to that. If the cost modifications increase or exceeds 25% of the total approved budget or $250,000, whichever is less, you're supposed to submit that request into ERA Commons as well. Change of scope is the same thing as well. Significant change in scope or objectives of the federally supported project activities identified and approved in the originally funded application. There's documentation in which you need to receive prior approval as well. Change in recipient organization, change in legal name, legislative changes by state or local governments, acquisitions, mergers, divestiture, or other changes, bankruptcy, closure, award relinquishment. If you don't want the award at the time, you need to get prior approval for those actions as well. We're not in this area of carryover funds or anything like that because we're at the start, but for when we go into the second year and there is a significant amount of funds left over, we'll send out information and directions in regards to carryover. Formal carryovers require prior approval. The request to carry over an unobligated balance of more of more than 25% of the award amount, or if there's a restricted status of recipients, again, that information needs request from the SAMHSA. Only responses provided by a grants management office or a grants management officer are considered valid. If SAMHSA approves the request, an amended notice of award will be issued. Verbal authorization is not approval and is not binding on SAMHSA. Recipients that proceed on the basis of actions by unauthorized officials do so at their own risk, and SAMHSA is not bound by such responses. The FFR, that's the SF425, the first one is going to be December 30th, 2020. It's due within 90 days after the end of each budget period, and it's submitted also through ERA Commons. Refer to your notice of award for the due date to submit the federal financial report to SAMHSA. There's also guidance with the link information that's provided on this PowerPoint slide, along with how do you report it, as well as instructions. Federal Cash Transaction Report. Recipients use the Federal Cash Transaction Report to report specific cumulative cash outlays of the payments. Reports are due to PMS, not to SAMHSA. The FCTR is utilized by HHS Division of Payment Management Services, which administers the payment management systems. The FCTR is due quarterly. Is not filed before if it's not filed before the due date, temporary suspension of funds and privileges and PMS will occur. Additional information on the FCTR is available at the DPM homepage, and that's the website information that's provided as well. Again, I'm going to provide some information about the due date, but the FCTR due dates are generally due quarterly. From October 1st to December 31st is due. The FCTR is due on January 30th. For the second quarter, it's due April 30th. For the third quarter, it's due July 30th. And for the fourth quarter, it's due October 30th. Again, the first one is due this coming January 30th. And this is a little bit of information. I think it's a snapshot of what FFR would look like. And in the next information is the audit reporting information. Recipients must contact and submit a single or program-specific audit conducted for that year if they expend $750,000 or more in total federal funds during the recipient's fiscal year per 45 CFR Part 75 Subpart F audit requirements. And this information basically, the earlier 30-day calendars after recipients of the auditor's report or 9 months after the end of the audit report period, there's a website information for information as well that's listed there. Continuation of the grant application, I think we can admit these because I think that we're all forward funded with these grants. ERA Commons. This is some helpful information that's going to, some linkage information for the help desk, and the toll-free number specifically for assist, as well as for ERA Commons, the terms tracker information. This is the help desk information, and as well as their hours of operation. This is the grant regulations for in regards to guide the grants for HHS, the policies, and I've also provided you some useful resource information as well, 2 pages of resource information for payment management system, the CFRs, the grants policy statement, as well as ERA. One of the things in which I don't want it to get lost on, the continuations or the amendments for key personnel for changes to your grant, your award, things of that nature, is totally different than what is required for October 1st that is listed in your notice of award. If you have an outstanding revised budget that is due October 30th, or you have an outstanding participant protection, if you have to submit your attestation letter, which all have outstanding or suspense date of October 30th, October 31st of this week, those are to be entered in ERA, the terms tracker, which is not a continuation or an amendment. Look at your notice of award, and it provides specific instructions on how to upload those documents, as well as specific due dates for those required documents as well. That concludes my information. I'm going to turn this over to Darren. No, I'm sorry. I'm sorry. Are there any questions? I'm sorry.
It looked like...
I do have one question. No.
Yeah, it looks like Carlos asked
No
just a
audit
confirmation question. No audit is required if it's under $750,000. Is that right? I believe this was slide 44.
Carlos, okay. Okay, Carlos, thank you kindly for your question. I'm not going to tell you a hard no. I can look at what the requirements are, what the request is for. We would need the specific details to find out what would trigger an audit.
Do we have any other questions on what Nicole presented about the budgetary and fiscal requirements of the grant?
And just a reminder, if you want to look these slides over more carefully, you can download the handout under the Files box.
Okay, if there are no further questions, we're now going to turn things over to Dr. Darren Fulmore.
Thank you. Good afternoon, everyone. I'm Darren Fulmore. I'm within SAMHSA's Center for Behavioral Health Statistics and Quality, and I'm the project lead for the system responsible for SAMHSA's performance management and performance monitoring. Next slide. So briefly, I'm going to give an overview of SAMHSA's Performance, Accountability, and Reporting System, also known as SPARS. I'll talk at a high level about the TOR grantees program level responsibilities in terms of Gipper reporting. And then finally, I'll wrap up with discussing the client level Gipper reporting for grantees that are serving clients. So real briefly, I'm going to talk a little bit about SPARS first for those who aren't familiar. SPARS is SAMHSA's system that provides a consolidated and centralized way of reporting Gipper data, Governance Performance or Results Act data. So it supports our program monitoring. It's a uniform approach for managing grantees by government project officers, and with the overall goal of improving quality improvement for all. So within SPARS, grantees will be able to submit their data, download their data, access resources, request technical assistance as needed, and then finally they'll be able to register and attend some online trainings that we've already pre-recorded. You can go to the previous slide. So we'll talk about that real quick. Per the funding opportunity announcements, all grantees are responsible for reporting at the grantee level, program level, and or client level grantee data, Gipper data, depending upon your funding application. SPARS will allow certain grantees, if they have the capacity, to batch upload their data. It usually depends on the grantee's capability of doing it and also the need, depending on the volume of clients being served. So as stated earlier, grantees will be entering their data into SPARS once you have provided account access. Grantees that are providing client treatment to grant or recovery services will be required to report their client-level data on elements, including but not limited to demographic, substance use disorders, services received, and types of MAT services received. I have stated earlier that at two levels you are reporting your Gipper data. At the program level, this is collected quarterly, and if grantees are serving clients and providing recovery support services, they'll be required to do this as well. I believe Amy reported previously that grantees can use up to 25% of their grant rewards to support their data collection responsibilities. Specifically, when we're mentioning program level or grantee level data, we're talking about the availability, distribution, and use of naloxone reversal kits. So there are basically 3 questions that all grantees that will be given accounts with SPARS will answer these questions. Whether you are conducting these activities or not, SAMHSA requires that you answer these questions, and you see them there. So if the answer is no to the first question, that interview is over. But if you say yes, then you would provide a number of how many kits were purchased, and finally how many are distributed. And again, this is reported to SAMHSA on a quarterly basis. For grantees that are providing recovery support and client-level clinical services, this is done at 3 major periods. At baseline, you have a 6-month follow-up requirement and a discharge on all of your clients. Grantees are required to achieve a target of at least 80%. We'd like to do 100%, but we understand it may not always be possible, but 80% is the minimum. That's your floor for the number of follow-ups that you should report into SPARS and back to SAMHSA. What you see here on this slide is a high-level overview of the tool, the Gipper tool, that SAMHSA grantees that provide client-level services. Once they're given SPARS accounts, then you actually don't even SPARS accounts. If you go to the SPARS website and you click Data Collection Tools, you can actually download and review this tool if you already have not done so. But here, I provide an overview of the sections within the tool. Section A is essentially things that you may be able to pull out of your own files. That's your records management section. Sections B through G, starting with past 30-day drug use, are what we call our national outcomes measures. So that's why those are asterisks. C is family and living conditions. D is about education, employment, income. Sections E are criminal justice status. Section F is mental health and physical problems, as well as recovery, violence, and trauma questions. Section G is social connectedness. Once you conduct your 6-month follow-up, you will complete all those sections plus Section I. On the discharge status, you will complete sections J and K. K will be your services received. So at the beginning of the interview and your baseline, there's planned services at intake, and then when the client is discharged, you would report on services received. So once you have your accounts and you understand the requirements of your particular programs, after this presentation, you should follow up with your government project officer to determine what are your performance reporting obligations, because they may vary. Some of you may not be conducting client services, so the client interview would not apply to your programs. If they do, you definitely want to go into SPARS and look at the frequently asked questions. You want to look at the question-by-question guide. You want to definitely make sure you reach out to your project officers to discuss any kind of technical assistance you may need, whether or not it will be data technical assistance or clinical technical assistance that you can get through your TTC contacts. And then afterwards, I think Amy discussed that you have about 4 months. Some of you may already be ready to collect client-level data now. That's okay. But I think you have until January 1 to begin collecting and entering your data. So that concludes my brief overview of your Gipper reporting requirements. I'm available to take any questions if you have any.
So it looks like we have a few questions. The one was, do we know how the amounts for the grant awards were determined?
The awards were based on the availability of funds, and also in the funding opportunity announcement, if they were not new awards, or they were new awards, I think it was a capped amount of $50,000 per applicant thereafter.
If they were not in
If they
Appendix
were,
K.
yes, if they were not listed in Appendix K.
Okay, and there's another question. A grantee says, Carlos said, they received the supplemental. When we submit the SF424A, do we combine the original grant with the supplemental funds?
No, no, this is totally separate. And if you look at that notice of award for that supplement, you're just going to address that for that award and that amount, and you're going to provide the justification and or narrative of how you're going to use or expend those funds in support of your project.
Okay, and Tamara Perkins asked, if a grantee is sending clients to an outside MAT provider but has hired peer mentors to support their recovery, does that require client-level Gipper data collection?
I don't believe so. I think this is one where this is beyond or outside of the grantee control, because you're actually kind of, I say outsourcing it, but you're sending it to a provider outside of your network. So I don't think this is one where you can submit into Sparse. Otherwise, they would have to get an account themselves.
We would ask that if there's, that you would try to make an effort to receive any of the referral information back to your institution and try to do a retrospective Gipper data report. But again, I think that will be done on a case-by-case basis with your government project officer.
Yeah, if you have more specific questions about whether your grant, whether it's appropriate or whether it will be required for you to collect client-level Gipper data in your project, please have a discussion with your government project officer about that, and they'd be happy to give you more information. And Karina Atkins asked, does every SAMHSA grantee have access to Sparse?
Once within about a month of when grantees are awarded, we would receive a list. Typically, it comes out of ERA or from grants, and we will create your accounts. So I'll probably be working with your project officers to make sure we have a complete, comprehensive list, and then you'll be notified. Once you're notified, it'll be a little grantee information form that you would complete. And again, depending upon your program, you'll see some might say, what are your targets for a client? Doesn't apply to you, wouldn't be a target there. The kits don't normally have a target, so you wouldn't complete that. We'll enter your account, and then anyone else that needs to have access to the account, say you have junior staff, you'd add those in as well. And so you'll get notifications depending upon the type of Gipper data that you're entering in the Sparse.
Okay, and then Jim Schweka asked, is it expected that 80% of the clients that started under the grant are going to be in treatment 6 months later for the follow-up, or can the follow-up be done within 6 months regardless of the client's participation in treatment?
Right, it is a 6-month follow-up. We do understand that obviously someone would not be necessarily in treatment for 6 months. That may be the case. It's a 6-month follow-up from the baseline or the intake interview. And keep in mind that a grantee may be discharged, so your 6 month can be after your discharge, but it is required that you do all those interviews.
Okay. Are there any other questions for Dr. Darren Fulmore about the data collection requirements under the grant? Looks like Carlos is typing. Okay, so Carlos Martinez asked, can we give incentives for Gipper participation?
Per the funding opportunity announcements, there are incentives for follow-ups and discharge. There are no incentives for actual doing the baseline. That's so that we don't want to give the impression that we're coercing or influencing people to participate in the program.
I'd say, also, could you please pay attention to what was in your grant application, what was said, the amount that you were going to provide. Also, the funding opportunity provides specific information, the capped amount, as far as for incentives in regards to Gipper or data analysis, things of that nature. So pay attention to the funding opportunity announcement as well as your grant application. If there's anything that changes significantly through your grant application, then that's going to change a few things. So take a look, see at your application as well as the funding opportunity announcement.
Okay, and then Patricia Talbot asked, will we get Q&A after the webinar? Yes, and we will put together the questions that were asked on the webinar and the answers, and we'll distribute that. And then Carlos Martinez asked, is there a I think he's asking, is there a $30 limit for the follow-up incentive?
I believe it's, I have to check the, it's $30, yes. It went up.
From 25 to 30.
Yeah, 25 to 30. So it's up to 30. So it really depends on your program and how you're allocating your resources.
And I want to say it's non-cash.
It's gift.
Yeah.
Gift cards or something along those lines.
Yeah. So again, pay attention to that funding opportunity announcement.
Any other questions?
Okay, if there are no other questions, then we will now be turning things over to Humberto Carballo, who will talk to us about the Technology Transfer Center.
Great. Good afternoon, everybody. My name is Humberto Carvalho, and I manage a lot of the technical assistance and training programs from SAMHSA. If you have ever been a SAMHSA grantee, you may be familiar with some of these programs. So I'm going to be specifically talking about the Technology Transfer Center program, and specifically because they have a support program in place exclusively for the TOR grantees. So what you see on the screen there is actually a screenshot of the SAMHSA website. And if you notice, on the second tab of the SAMHSA website, we have a tab called the Practitioner Training. The tab is highlighted with a red circle. On that tab, you're actually going to find portals for several different trainings and technical assistance programs that SAMHSA has put in place to serve not only grantees but any provider in the country. In the past, SAMHSA's grants, they were associated with a contract that would provide technical assistance exclusively for those grantees, participants from the cohort of that grant. However, nowadays, all our technical assistance and programs, training programs are pretty much open to any type of provider anywhere in the country. So if you look at this tab, you're going to see several of these programs. In the first program highlighted there is actually the Technology Transfer Center program that I'm going to be briefly talking about right now. So the Technology Transfer Center's program is actually comprised of three networks. One is the Addiction Technology Transfer Centers, the other one is the Mental Health Technology Transfer Centers, and the Prevention Technology Transfer Centers. Each of these networks, they are comprised of 13 centers that are located throughout the country. We have one national coordinating office for each of these networks. We have one Hispanic and Latino national focus area for each of the networks. And we also have a national focus area, American Indian, Alaska Native Technology Transfer Center also for each of these three areas. The National American Indian is actually all the three centers, the addiction, the mental health, and the prevention, they are actually co-located at the Iowa University. And you are going to hear a little bit more about this program in a moment when the team from Iowa will take over. But before, I just want to show you there, you can access training and technical assistance and any type of information if you from any of these three networks by looking at their website, which is actually highlighted there in each of those three color box. And you're going to notice that the websites from all these three networks, they pretty much have the same backbone structure. You have a tab where you can find regional center located close on the state where you're located. You have an educational tab that provides training and event information, and on that educational tab is that where you're going to find a portal that we call the Health e-Knowledge that provides online training that are self-paced. They are all free online trainings. The only charge that you pay is if you want to receive CEE-CUs, and in that case, it's about $5 per credit. Most, if not all, of the trainings on health and knowledge provide the CEE-CUs. So you also have a resource tab with a lot of access to products and resource catalog. You can search for resources by using keywords. There's also a tab that has focus on projects, another in communication, and usually one tab that's about the information, general information about the network. Next slide, please. So what you see in this slide is pretty much the name of the institution and where all the TTCs are located throughout the country. If you can see, each region, each of the HHS regions, we have 10 regions, they all have one ATTC, one MHTTC, and one PTTC program. And they're most of the time collocated with universities. And on top of the picture, you see the institutions there are housing the National Coordinating Office, the National American Indian, and also the National Hispanic and Latino Centers. This is just, apologize for the small print, but you can, once you download the picture, you can actually blow and you can see, you can read the name of the institutions over there. So next slide. So the way that those networks provide training technical assistance is actually in a very self-service model. So they provide, they use several different modalities which involve information dissemination, which can be throughout electronic publications, email distribution, social media. They do a lot of learning events that can be either in person. They sometimes associated with conferences. There are national or regional focus conferences. They provide a lot of training of trainers and webinars. They also do a lot of virtual learning communities. They, like I said before, they provide a lot of different online courses that can be either instructor-led or in most of the cases they are actually self-paced. And they also provide intensive technical assistance, which is basically pretty much a joint of efforts, which sometimes comprise of a connected learning series, a peer learning series network, and we usually use echo trainings for several of those intensive technical assistance. The TTCs also do a lot of product development, and they also do consultation that can be done on a one-on-one basis via connecting with your regional center or with the American Indian Alaska Native National Focus Area Centers. And but most of the time, those consultations are either virtual, and in few cases, they are in person, depending on how close the grantee or the provider is from the centers. So next slide, please. So the American Indian Alaska Native ATTC network, they actually have, if you go to their page on their website, you're going to notice that on the carousel of their page, they actually have a program dedicated to the TOR grantees. And what you see on this slide is actually a screenshot of the page that describes pretty much the tribal opioid response program, the technical assistance that they deliver for all TOR grantees. And on a second screen there, you see the webinars. They actually record all the webinars and trainings that they have provided, and any of you can access any of those webinars through that carousel on that page, and you can watch these webinars anytime, as many times as you want. So what I'm going to do now is I'm going to turn over to the Iowa University team, and they're going to provide some more specific information about the technical assistance they are providing for the 2018 cohort of TOR grantees and what it can be expected by your programs from that team. So Iowa, with you.
Okay. Hi, everybody. This is Pam Baston. I'm with JBS International, and I will be covering some very practical information about the kinds of TA that you might want to ask about or inquire about. The first is that we do have webinars, as Umberto mentioned. Those webinars vary by topic and may include such things as medication-assisted treatment. You know, some tribes are more comfortable with some medications than others, so we cover all of them and provide basic information about each one. We also have webinars on strategic planning. We have it on prevention. I think we've done one on workforce development. But we are able to develop webinars on topics that come to our attention through your request. So if there's a particular area you'd like to learn more about, please feel free to let us know. We also have learning communities. Learning communities are a little different in that all of these, by the way, are optional, but some grantees might be focusing on pregnant and parenting women. Some might want to focus on adolescents, and so we might have learning communities on engagement strategies or on how to promote your program in the community or an anti-stigma campaign. So as we develop learning communities, you're able to jump in. They might last about 6 weeks, so it might be, as an example, every Wednesday from 2 to 3. And you would decide if that learning community makes sense to you. So we'll be looking to you to let us know what kinds of topics you would like to learn more about. We also have some templates and tools. In just a minute, we'll showcase them when I finish this slide to show you some that are available right now. And again, we can develop them as we go, so I'll hold off on that for just a minute. We have regional grantee technical assistance meetings. These are not SAMHSA grantee meetings. These are technical assistance meetings. This photo here on this slide is one of a partial group of individuals, of grantees, that met with us last week when we were in Billings, Montana. The regional meetings are about 2.5 days in length. We highly recommend, if you have the ability to join us, that you do, because the most valuable thing is not only to learn about the resources available and to get technical assistance, but to learn about all the exciting work that other tribes are doing. And there's a lot of peer-to-peer sharing, which we find to be one of the most valuable technical assistance strategies. So that would fall under the peer-to-peer assistance. We're very good about if one of you, for example, were to call and say, I'm really struggling with a particular issue, we might say to you, well, we know 3 tribes that have successfully overcome that barrier. How about we try to set up a call with all the parties involved or with particular subsets of individuals. So we have the advantage of having that kind of perch of knowing what's out there, what's been happening, and what might be working well. And we have some very limited face-to-face TA available this year that was not available last year. But again, we can do quite a bit of this on Skype as well, so we don't have to be face-to-face. Next slide. So here's an example. Last year we got requests for job descriptions. The applications went in very quickly for the first round of TOR grantees, and many of them did not have a chance to really conceptualize what kind of job description might be relevant for their grantees, or excuse me, for employees. And so we had a number of calls saying, do you have one? And so we created one that we mapped back straight to the RFA, so or to the FOIA, the Funding Opportunity Announcement, so that this particular job description very much tracks what the activities were in the actual Funding Opportunity Announcement. Having said that, remember the Funding Opportunity Announcement is what comes to you to respond to, but then you then create a response to say, what do you propose to do? So we do all of our tools in Word format so that you can edit them, change them, adapt them, make them fit the needs of your tribe. So these are just partial screenshots. The full instrument or the full tool is available on the TOR resource website. And then right after we were asked about the job description, we got multiple calls saying, well, we don't know how to interview these folks. Again, this is a brand new initiative. What are the key questions we should ask? And so we created an interview guide that allows you to rate applicants 1, 2, or 3. I don't remember which direction that it went in, but I think it was 1 that they have a lot of experience, 2 that they only have some experience, and 3 that they have little to no experience. And we then again mapped it right back to the the funding opportunity announcement. So there were questions about substance use disorder, opioid use disorder, recovery support, prevention, so that you could have a very comprehensive interview and be able to make sure that the person you hired, had the skills, including culturally relevant skills to make whatever they do in your project make sense to your tribal needs. Next. So we also noticed we did have one national meeting last year. It was in Minnesota in April. I'm not sure that we're having one this year, but last year we had everybody come, and that was as opposed to the regional meetings. And basically, probably the number one concern we heard from tribes is that the members who were implementing these awards were not the ones that wrote the grant. They would say, we either hired an external grant writer or we had somebody in our administrative office that might be located miles and miles away, created the grant application. We then, sometimes they have a copy of it, sometimes they don't, in terms of the implementers. And so they came to this meeting and said, we don't even know what we're supposed to be doing. So we created another tool, and what this is, again, all of these are modifiable, but what we did is we basically went back to the funding opportunity announcement, created some sample activities that you would be expected to complete potentially with your funding opportunity announcement, created almost like a to-do list or an action list where you could describe what the activities were, who is supposed to do them, when they're supposed to be done, and this is, again, just a partial screenshot, but most of the tools that we create, we even fill out one example cell so that you can see what it looks like completed. So we even gave you a couple of typical kinds of activities that would be associated with this award so that you could see how that would look completed. Next. And I believe Jeff mentioned, or someone did, that we do have a strategic plan template. Again, we created this in response to grantee requests. This is an example of a very basic strategic planning template. So, some grantees got much more sophisticated and fancy, and we also offered multiple other formats. We worked with Harold Tarbell, and he pulled together a few additional templates that we made available on the TOR resource page, but this is just one sample, and what we do recommend is that you go, here's an example filled out, what one might look like partially filled out. Again, we use red ink typically to show just sample language. You would want to adapt that to meet your needs. We do highly recommend that you work with your Tribal Epidemiology Center because they have a tremendous amount of data that can inform your strategic planning activities. Next. And then I know that it was mentioned earlier, the tribal agenda. This is an example of the Tribal Behavioral Health Agenda link that could link you to the little thumbnail on the left. This is an incredible document that has, if you haven't taken the time to look at this, I really recommend you do. Not only is it this beautiful artwork, as you've seen here, but very well crafted strategies and priorities that relate to behavioral health. And if you're struggling with how to get your TOR initiative aligned with your other behavioral health initiatives, you'll be inspired by some of the guidance that is offered in this agenda, and then also with the National Tribal Health Board that can give you some guidance as well. Next. So I mentioned that we have some webinars. We also, during the regional meetings, we provide various presentations. This is one we did recently on stigma and service barriers. We were hearing universally, I don't know that we had a single tribe that didn't mention significant barriers and stigma associated with opioid use disorder, that many of the individuals who had opioid use disorder were reluctant to admit that they had this problem. They didn't know where to go. They were afraid to come in for service. They were embarrassed, so we not only provide some guidance around stigma reduction, but we then had a very large conversation around how this presents and what some solutions might be. As part of that, we created, if you look below the little, the top little thumbnail is an example of the PowerPoint front page, but within that, this is just one sample slide where we walked through some various language opportunities to say, for example, in this case, we would never talk about a baby as being drug addicted, because to be addicted, you have to have a lot of behavioral criteria. You've tried to quit and you couldn't. You find yourself, isolating and not being around friends. Obviously, a newborn can't have behavioral examples of a opioid use disorder. They are physically dependent, potentially, on opioids having been transmitted from mom, but they're not certainly addicted. So we provide that rationale. There's probably 20 other examples that we provide in here, because as we say, if you're wanting to reduce stigma in your tribes, then it's important that all of us look at our language. And so we'll be updating this in real time. We did just hear another term that was used. We heard this for the first time last week, that there is a term called druggy buggies, which we found fairly offensive, that when individuals were coming out doing outreach in the community, some of the tribal members were referring to that van of individuals that were coming out for outreach and help as the druggy buggy, or if they were going to do any kind of mobile work with the treatment program. So this is an ongoing effort, and it's just one example of some of the resources that are available. Next. So this is in response to, we had some requests from grantees who are working with pregnant women, and they indicated that they had never worked with pregnant women with opioid use disorder and didn't know what to expect. And so they were very motivated. They felt like they had a good lead on how to get clients, but they said, we don't know what to do when they show up at the door. And so what we did is we went back to a clinical guide that SAMHSA has pulled together for pregnant and parenting women, which I'll show you in just a minute. And then what we did is created a case study so that, and it's just only a few pages. Again, this is available on the resource page, the TOR resource page at the American Indian Alaska Native ATTC. And basically what this does is gives you a scenario and then brainstorms, well, what might you do if you have this pregnant woman coming, and we make her real by, describing her and showing you a picture of what she might look like and what problems and opportunities might come along with her. And so we then recommended things like, if she's pregnant and she's opioid using, coming along, getting there to your facility in and of itself is going to be a huge step for her. So to make her feel more welcome, what might you do in terms of reaching out to her, letting her know, oh, I see you're coming on Tuesday, really looking forward to seeing you. Is there any barrier we can help reduce? Do you need transportation? Anything that will stand in the way of you coming, maybe sending some inspirational messages, anything that we could do to encourage her to, in fact, follow through on her next appointment. And then we walk through a lot of different scenarios. And if you go to the next page, you'll see the clinical guide. The next slide is the SAMHSA clinical guide that we pulled the information from. And if you have not had a chance to look through this document, again, all of this, the links and everything will be provided to you. This is a very practical guidance document that walks you through everything dealing with pregnant opioid using women in all the way through even breastfeeding. So, and how does that work with medication and so forth. Next. Our grantees are extremely creative, and I've said before, I've been in the field 40 years now working with substance abuse, and both at the local, state, and now national and tribal levels. And I can honestly say that I've never seen more creative, compassionate people than I have seen and had the opportunity to work with through this TOR initiative. These are just two examples. We have many others of ways that the grantees have created artwork to promote the work that they're doing, and so you can see who created these. The one, by the way, on the right was created by some interns even who were working in the TOR initiative, in this case with the Cheyenne, the Northern Cheyenne tribe. Next. So we're down to the last couple of slides here. I mentioned that we have these regional meetings, and we created a document that reflected some of the interesting approaches that many of the TOR grantees were undertaking. This first one to the left had to do with making sure that the Yakama Nation has all patients apply for Medicaid to confirm eligibility, and it helps them be able to use existing funds before TOR funds are accessed. So this is sort of an engagement strategy, and to do everything we can to help these individuals have third-party reimbursement for the services that they're getting. And also the Yakama Nation created a radio campaign called Not on My Res. And this was a very clever, catchy strategy that they used to get the youth to become aware of the dangers of opioids. Next. And then the Confederated Tribes of Warm Springs, they conduct a Native American Opioid Training Academy, and they have a catchphrase they use called pain in the brain, and that was to reinforce that this is a brain disease, this is not a moral weakness, and they use other catchy terms to assist with engagement. Also, the Shoshone Bannock tribe at peer recovery training held every other month. They build a network called Smudge Me, Don't Judge Me. And this is, again, part of the whole anti-stigma reduction campaign that many of your peers that are in the cohort before you are engaged in. And then last but not least, this is the example of the document that you can find on the TOR website. And this would include some of those examples that I just showed you. We just got it back from editing, so Jeff, I'll need to send you the clean version that you can replace if there's one up there already, just to get the most updated version. All of these documents that we've shown you are just some examples of what we have to offer, and also they will generally be updated in real time. So you may check back every few months as new, for example, with the stigma campaign, the druggy buggy, that was the first we had ever heard a term like that. So we'll go in and update that, and as we learn and hear more things, we will try to keep all of those resource documents up to date for you. So we're very excited to get a chance to work with you. You're very lucky to have had the first cohort already on the learning curve and making progress towards sorting out some of the challenges and really looking at some very creative, culturally relevant traditional practices to add to their evidence-based practices such as MAT and others. So we're here to help in any way, and Jeff, I don't know if you want to take a minute to explain how technical assistance is requested, but I'm certainly also available if anybody has any questions. And thank you for your time.
Thank you, Pam. My contact information is under the contact and support section. I believe I posted my phone number in the chat box as well, so you can give me a call. I do want to add of the resources that we have on our webinar page. I think the ones that would be most immediately useful to you would be the recordings of our rapid strategic planning webinars that we held last year for those of the tribes looking to develop a strategic plan, along with our template that I provided a direct link to. Okay, and I think we had some questions come up. Elizabeth asked, are there links to these promotional, educational, creations.
So, you know, this just happened last week. The two examples we just showed you came from our Montana meeting. And to our delight, both of the individuals that presented these, when asked, could these be widely shared and utilized by other tribes, were emphatically in agreement that yes, these could be used more widely for the benefit of others. And Jeff, the question would go to you as to, I know we have their PowerPoint presentations that you have that I think you have either loaded or will be loading, and I think you might, if you want other copy, you know, of, for example, the graphic, what they call the Indian in the bottle graphic, you might have to reach directly out to the Northern Cheyenne tribe, or unless, Jeff, you have a strategy you want to suggest.
Yeah, I will reach out to them and see if I can get it posted in a few days. I just want to make sure I have their permission before sharing it on our page.
Yep, absolutely. And Jeff, I saw the question about the regional meetings. We have one in Fairbanks, Alaska, November 18th through the 20th. And then, but I believe, is that the last one that we have a date on, and then we also start going, when the weather thaws, we go southeast?
Right.
Is that correct? Or we go to Oklahoma?
Yep,
Where do
Oklahoma
we
City,
go?
and then possibly Florida or some other eastern state.
Okay. And we don't have dates yet for those. I think we're in the process of getting that, but correct me if I'm wrong. Any other questions?
Patricia asks where we find meetings and dates. You can contact me directly, Patricia.
And won't they be posted on the TOR resource page as they're confirmed?
Yes.
Are there any other questions for any of the presenters who've been on the webinar today? Okay, if there are no other questions, I'm just going to turn it over to Dr. Thundercloud, who will close this out.
Well, thank you, everybody, for participating in today's call, and welcome to Cohort 2. We're very excited to work with you, and our office is really excited to make you successful in this grant. I want to thank the Center for Behavioral Health Statistics and Quality and the Office of Finance Resources and the Technical Training Centers for their participation on this call. So as you can see, we do have a lot of internal resources, and our office has a lot of connections to help you overcome any obstacles that you may encounter while implementing your TOR. So again, I just want to remind you that our GPOs here are here to make you successful in the implementation of your grant, and we will provide you with the resources and the technical assistance that you need, and we will provide it in the way and manner that you want it provided. So please allow us to listen to you and understand how you want us to provide your training and make this a community-driven program so that you will have positive outcomes within your communities and an impact on the lives of our AIAN children. Thank you.
All right. Thank you, Dr. Thundercloud. And with that, I'm going to end this meeting.